I think people are awakening to this idea that, the body can heal itself, but we just have to put it into the state where it can do so. And that if we're bombarding ourselves with pharmaceuticals, if we're bombarding ourselves with things that reduce symptoms, you're not actually affecting some of this underlying issue. And, our medical system, unfortunately, often is not geared to make us healthier. It's geared to making us less sick. And so if we're only focused on getting less sick, then we're going to be tied up in sort of what this allopathic medicine model of pills and needles and some of these quick fixes that frankly, they don't work in the long run. And if you really look at the research, they actually shorten your lifespan, not lengthen it in many cases. And obviously there's always exceptions to this. But when you talk about the Alpha-Stim, I think there's this increasing trend towards more holistic approach that, yes, we want to have the scientific backing of different surgeries and interventions and needles when it's needed. But when it's not, the over application of that actually makes you actively worse. And if you look at the behavioral health trends, depression, loneliness, anxiety, I mean, look around. Who doesn't have anxiety? It seems like every person out there from, you know, 9 to 11-year-olds to, the elderly and everything in between has some level of anxiety. And we can't just pop pills. We can't just look for these quick fixes that are invasive. And I think what's beautiful about the Alpha-Stim is I love to pair it with other things. That's where you really see the true capabilities of it. And so you do your breathing exercises. Go out in your backyard and just sit there and meditate or pray. Put your Alpha-Stim on when you're doing it. That's the beauty of it. And, when we're talking about barriers, I think the barriers are just this over reliance on some of these conventional things. And I think just getting providers to open up their mind that there are other ways up the mountain aside from some of these shortcuts that often come with downfalls. And to me, a barrier is just knowledge and awareness of it. Personally, in dealing with other professionals, I don't know that I've seen a single provider who, when they saw the effects, was not an advocate. Maybe not necessarily like out there beating their chest Alpha-Stim, but they were certainly like, yeah, we can see the role of this device because the providers here know that, in my experience, when the patient has that as part of the treatment team, as part of the mode of care, I think a lot of times it's just more comfortable for them. There's less anxiety as they're doing stuff. They seem to be more responsive and open to change. And so I think just getting the information out there, giving it a try, and if it works for you, be open-minded, be more focused on your patient outcomes